5. Signs an elderly person may be in their final year. Subtle warnings you shouldn't ignore. Welcome to today's video on a sensitive and important topic. 5 signs an elderly person may be in their final year. Subtle warnings you shouldn't ignore. As our loved ones age, it's essential to recognize the signs that may indicate their health is declining. In this video, we'll walk you through the subtle yet crucial signs to watch for so you can provide the best care and support. If you find this information helpful, please leave a like, comment, and subscribe to our channel for more valuable content. Don't forget to share this video with others who may benefit from it. Signs. 1. Significant weight loss. Sudden and unexplained weight loss in elderly individuals can be one of the most alarming signs of declining health. When a person loses weight without any intentional change in diet or lifestyle, it can indicate a number of potential health issues, some of which may be serious or life-threatening. As people age, their metabolism naturally slows down, and they may experience a decrease in appetite, which can contribute to gradual weight loss. However, significant or rapid weight loss, especially if coupled with other symptoms, should not be dismissed. One possible cause of significant weight loss is malnutrition, which is common in elderly individuals due to poor dietary habits, difficulty eating, such as trouble chewing or swallowing, or a lack of access to nutritious food. This can lead to muscle wasting and a weakened immune system, making the person more susceptible to illness and infections. Chronic illnesses are also a major factor in unexplained weight loss. Conditions like cancer, chronic obstructive pulmonary disease, COPD, or heart disease can lead to significant weight reduction as the body consumes more energy fighting the disease. In some cases, the body may become less efficient at absorbing nutrients, which further exacerbates the weight loss. Additionally, thyroid disorders such as hyperthyroidism, where the thyroid produces too much hormone, can lead to accelerated metabolism, resulting in rapid weight loss. A decrease in appetite can also occur due to aging-related changes in taste and smell, depression, or cognitive decline, all of which are common in older adults. If you notice significant weight loss in an elderly person, it's important to seek medical advice to rule out serious underlying conditions and ensure they receive the appropriate care and nutritional support. Early detection and intervention can significantly improve their quality of life and overall health. Signs 2. Extreme fatigue and weakness. Extreme fatigue and persistent weakness in elderly individuals are warning signs that should not be ignored. As people age, it's common for energy levels to decrease. But when the fatigue becomes overwhelming or interferes with daily activities, it could signal underlying health problems. Chronic tiredness, or a feeling of physical weakness, is often a result of the body struggling to maintain proper function. One of the most concerning causes of extreme fatigue in older adults is heart failure. As the heart weakens and becomes less efficient at pumping blood, the body may not receive enough oxygen and nutrients, leading to fatigue, weakness, and shortness of breath. This can be especially evident after even minor physical exertion, such as walking or climbing stairs. Heart failure can be gradual and sometimes hard to detect, but persistent tiredness is often one of the first symptoms. Muscle degeneration, or sarcopenia, is another condition that frequently causes weakness in elderly individuals. As people age, they naturally lose muscle mass and strength. This process can lead to a feeling of fatigue, difficulty walking, and a lack of energy even after rest. Sarcopenia often goes unnoticed until the person's mobility becomes significantly compromised, making it crucial to observe any unusual tiredness or inability to perform physical tasks. Additionally, general organ decline, such as reduced kidney or liver function, can result in fatigue. The body's ability to filter waste and regulate essential functions may diminish with age, contributing to a feeling of constant exhaustion. Anemia, where there is a shortage of red blood cells or hemoglobin, can also lead to persistent tiredness as the body struggles to deliver oxygen to vital tissues. If an elderly person experiences ongoing fatigue and weakness, it's essential to consult a healthcare provider to identify the cause and address any potentially serious conditions early on. Proper diagnosis and treatment can greatly improve quality of life. Signs 3. Changes in mental state. Changes in mental state, such as confusion, forgetfulness, or noticeable cognitive decline, are common signs that may signal the onset of dementia or other neurological issues in elderly individuals. While mild forgetfulness is often associated with the natural aging process, more significant changes in memory, thinking, or behavior could indicate a deeper concern. These cognitive shifts should never be dismissed, as they can be linked to serious health conditions that require prompt evaluation. One of the most common causes of cognitive decline in older adults is dementia, which encompasses a range of conditions, including Alzheimer's disease. Dementia is characterized by a gradual deterioration of memory, reasoning, and other cognitive functions, which can make everyday tasks difficult. Individuals may become confused about familiar places, people, or routines, and they may struggle with tasks they once handled easily. Forgetting appointments, misplacing items, or becoming disoriented in familiar surroundings can be early signs of dementia. Delirium, another cause of mental state changes, is often temporary and can be triggered by infections, medications, or dehydration. Unlike dementia, delirium tends to come on suddenly and is usually reversible once the underlying cause is addressed. However, it can still be a red flag for serious health issues, particularly in older adults whose bodies are less able to cope with infections or medical treatments. Depression is another condition that may manifest as changes in mental state. Elderly individuals may experience cognitive symptoms, such as difficulty concentrating or remembering things, as part of their depression. This is often mistaken for dementia, but treating the depression can often improve cognitive function. If an elderly person begins to show drastic changes in their mental state, it is crucial to monitor for other signs and consult a healthcare professional. Early diagnosis and intervention can improve the individual's quality of life and help manage the underlying cause of the cognitive changes. Signs 4. Frequent infections or illnesses. As people age, their immune system naturally weakens, making them more vulnerable to infections and illnesses. For elderly individuals, frequent infections, especially respiratory issues or urinary tract infections, UTIs, can be a significant warning sign that their body's defense mechanisms are no longer functioning as effectively as they once did. When an elderly person experiences recurrent infections or illnesses, it could indicate that their immune system is struggling to protect them from pathogens and environmental factors. Respiratory infections are particularly common in older adults due to weakened lung capacity and a reduced ability to clear out mucus or bacteria. Conditions like pneumonia, bronchitis, and even the common cold can be more severe and harder to recover from in older individuals. Symptoms like persistent cough, shortness of breath, or chest congestion should be closely monitored, as they can lead to serious complications if left untreated. Urinary tract infections, UTIs, are another common issue for older adults, especially women. The urinary system becomes more susceptible to infection due to a variety of factors, such as reduced bladder control, decreased kidney function, or the use of catheters. UTIs in elderly individuals often present with symptoms such as confusion, urinary incontinence, and frequent urination. These infections can sometimes be overlooked, especially when cognitive decline is also a factor, but they can lead to sepsis or kidney failure if not addressed in a timely manner. Frequent infections or illnesses in the elderly can also be a sign of chronic conditions like diabetes or cancer, which compromise the immune system. A weakened immune response means the body cannot fight off infections as effectively, leading to longer recovery times and increased risk of complications. If an elderly person is experiencing frequent infections or illnesses, it is crucial to consult a healthcare provider for proper diagnosis and treatment. Strengthening the immune system through proper nutrition, hydration, and medical intervention can help reduce the frequency of infections and improve overall health. C. Signs 5. Decline in mobility and coordination. A noticeable decline in mobility and coordination is often one of the most concerning signs that an elderly person's health is deteriorating. As people age, the natural wear and tear on their body can lead to difficulty with balance, walking, and performing everyday tasks. This decline in physical function may be linked to muscle weakness, arthritis, or neurological conditions, all of which can significantly impact their quality of life and overall well-being. Muscle weakness, or sarcopenia, is a common issue in older adults. As muscle mass naturally decreases with age, individuals may struggle to perform activities that once felt effortless, such as standing up from a chair, climbing stairs, or even walking. Weakness in the lower body can result in poor balance, making falls more frequent and increasing the risk of serious injury. In some cases, muscle weakness can also be exacerbated by conditions like malnutrition, chronic illness, or medication side effects. Arthritis is another common contributor to a decline in mobility and coordination. Osteoarthritis, a condition in which the protective cartilage between joints deteriorates, can cause significant pain and stiffness, particularly in the hips, knees, and hands. This makes walking or performing routine tasks increasingly difficult. The pain from arthritis can lead to a decrease in physical activity, further exacerbating muscle weakness and mobility issues, creating a cycle of declining function. Neurological conditions, such as Parkinson's disease, stroke, or even age-related cognitive decline, can also affect coordination and balance. Parkinson's disease, for example, leads to tremors, rigidity, and bradykinesia, slowness of movement, all of which impact a person's ability to move freely. Similarly, strokes can cause partial paralysis or difficulty coordinating movements. A decline in mobility and coordination can be a critical sign that an elderly person's health is declining rapidly. If these changes are observed, it's important to seek medical attention. Early intervention through physical therapy, medication, and lifestyle changes can often help manage symptoms and improve mobility, reducing the risk of further complications. Conclusion. In conclusion, recognizing the signs of health decline in elderly individuals is essential for ensuring they receive the proper care and support. Significant weight loss, extreme fatigue, changes in mental state, frequent infections, and declining mobility are all critical indicators that should not be ignored. These signs may signal underlying conditions such as heart failure, dementia, or muscle degeneration, and early intervention can significantly improve their quality of life. If you notice any of these warning signs, it's important to consult with healthcare professionals to provide timely treatment and enhance the well-being of your loved ones.